men have prostate cancer in their lifetime. Have you ever heard that statistic?
It's under 20.
Yeah, that's right. You're smart. Because most people think, wow, every man's going to get prostate cancer if they live long enough. Well, that's not correct. Your number is exactly right. It's 16.5% of men will get prostate cancer in their lifetime.
Okay.
So you're like the smartest person around, but again, you're a medical student at a great school, so you should be.
Thank you.
But you were awake. You had to be awake to know that. So what was the reduction in prostate cancer mortality after PSA was adopted? Do you have any idea?
I'm going to guess 10 to 15% reduction.
44%.
Wow. That's a huge percentage.
Yeah, nothing to sneeze about and nothing doctors need to be defensive about. To reduce death rate by 44%. And these are men in the 50s, 60s, 70s. So men often in their prime of life, we were able to reduce the death rate by screening, early diagnosis, and effective treatment. So one approach was active surveillance, try to say, okay, you've got a low risk, we're just going to watch you. Now we know that watching costs the same and causes a lot of anxiety, and you can have treatment with us as quickly as 45 minutes, one visit, and you're home, and that's it, or go to work, go to lunch, go to the movies. And also with the watchful waiting, I mean, there's biopsies, and about 2% to 4% of men who have biopsies get septic from the biopsies. So,
right, yeah.
You know, so that's one of the costs. If you have factor in 2 to 4%, and it's not just one biopsy, you're getting biopsies whenever something suspicious is going on. So maybe multiple biopsies.
Yeah, it's a lot of risks.
So the other approach was to try to prevent prostate cancers. Now, 2012, I said there's 200,000, but actually in 2012 there were 241,000 prostate cancers diagnosed in America. So it's a lot of prostate cancers, and you can imagine why the emphasis is on prostate cancer. And there's a drug called Proscar. Have you ever heard of that or given it to a patient?
I have not.
Well, there's a lot of men on Proscar. It's to reduce the size of the prostate. It also reduces the PSA, so it makes it hard for us doctors to evaluate a patient on Proscar because we know that the PSA, which let's say really might be 6, now on Proscar is only 3.
Okay.
So it makes it hard to determine whether or not that man should get worked up for prostate cancer. So anyway, it does reduce the size of the prostate. It does reduce the PSA. And so doctors in about 20 years ago started a study, a randomized study, to see if Proscar could reduce the incidence of prostate cancer.
Okay.
Okay, so it reduced the PSA, it shrunk the prostate, and there was some data suggesting that it was going to reduce the rate of prostate cancer. So there was a study reported called the Prostate Cancer Prevention Trial, and it actually reduced prostate cancer by 24% in men. But the problem was it did reduce it.
Right,
so a quarter less men in a randomized study, so a great study.
Yeah, it's pretty good.
Had a reduction. But the catch was there was a marked increase in the rate of high-risk cancer. So remember that movie that, I don't know, about 5 years ago that these researchers were trying to find a cure for some terror. What was the name of that movie?
I don't remember the name, but
it was in New York City, and finally it creates monsters, this drug, right?
Yeah.
And then all of a sudden a few people, all of America's wiped out from these monsters, and a few people end up in Vermont to try to rise again.
That's right.
That medicine creates a monster. Well, this is the monster. We reduce the good cancers, and we increase the bad cancers. And that's what Proscar did. And so it was a very hopeful study, and people obviously, many people say, I want to go on that randomized study. There's a new study. There's a new clinical protocol. Yes, I was accepted on it.
Right.
Well, here you get accepted on it, and you're increasing your risk of getting the bad cancer when you're really trying to get on the study to reduce your risk of cancer altogether.
Right.
So, yes, Proscar did decrease the PSAs. It did, in certain patients, reduce the risk of or the need for getting a biopsy because the prostates were smaller, the PSAs were less. But what happened, it seemed, was that higher risk cancers were either stimulated and it must have been they were stimulated because there were more high-risk cancers that developed in the control groups, in the treated group. So there are two groups, one that had placebo or sugar pills, and one that had Proscar. And there was increased death rate in these in the high-risk patients. And the study had been going on for more than 18 years. And unfortunately, a lot of the centers that did the study had closed. So two decades later, they tried to use Social Security numbers. In America, if you have a Social Security number, you can punch in and see if you're alive or dead.
Yeah.
That was at least true until 2011, and then the Social Security Administration changed their mechanism. So they weren't able to use that by itself either. So they looked at survival rather than absolute prostate cancer diagnosis in later years. So in early years, they were able to look at the type of prostate cancer. When the study ended after 7 years, they offered all men, this is more than 20,000 men, a biopsy of their prostate to see if there was cancer or not. So that data was also included in this. And basically, doctors came away very frightened by trying to prevent prostate cancer with Proscar because you were inducing these high risk cancers.
Yeah, it's terrible.
So it's terrible, and basically it must have been a very expensive study because you have 20,000 men who were biopsied, who were followed, who were treated, who were watched with PSA. So I imagine it probably cost $10,000, $20,000 a man. So talking about probably tens of millions of dollars studies. It was sponsored by Merck, which was a company that made Proscar, and they probably weren't too happy with the results of this study. So anyway, it's interesting for people to know that, I got on a clinical protocol, but maybe you don't really want to be on a clinical protocol, or it's good for society to learn this information, which is the point. It's good for society.
Right.
But it may not be good for each man who's enrolled on it.
Absolutely.
And the men on the sugar pills maybe were better off than the men who got the Proscar. So anyway, it's an interesting study. It's in this week's New England Journal of Medicine, which is one of the premier medical journals in America. We're going to go to a word from our fantastic sponsor, and then we'll be back to take your calls and to talk about some of our patients and some other information.
For new or recurrent brain tumors, Radiosurgery New York specializes in non-invasive radiosurgery. First in New York with painless, fractionated brain radiosurgery, we have decades of expertise in brain tumor treatment. Hi, I'm Dr. Gil Lederman. Critical to every patient, every family are results and quality of life while avoiding radical surgery. Our brain radiosurgery may be used even if prior surgery, chemo, or radiation didn't work. And our radiosurgery experience includes treating thousands with brain metastasis, glioblastomas, acoustic neuromas, meningiomas, and more, with no cutting, no bleeding. Our brain tumor treatment is outpatient with most insurances, Medicare, Medicaid accepted. A fresh second opinion could change your life. For brain tumor treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the brain tumor. Call 212-CHOICES, 212-CHOICES to hit the brain tumor. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery. For cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere